ancestral lands of the Coast Salish peoples. That is the Squamish, the Musqueam, and the Tsleil-Waututh. And we have a lot of people joining us today, which I'm really pleased that so many of you have taken the time to be with us. And I want to just make a few points before I introduce our special guest. So this is a special Lunch and Learn in that we're incorporating into our Wellness Day. And by the way, our Wellness Day this time, our third version of it, is being done in a partnership with our colleagues in Surrey. And I see Mr. Steve Dooley there, who's going to be humiliated this afternoon in a cooking competition. So thank you so much for showing up. And so I want to also mention that today we are going to be talking about mental health. And sometimes when you talk about mental health related issues, depression, anxiety, and so on, it can generate a strong response in some people. And we understand that. And if that does in fact happen to you, please notice that at any time you can, of course, turn off your screen, or we can also have help available. And you can see there that Alyssa has put into the chat line 2 sources of contacts for you if you want to chat with someone. Both the SFU Health and Counseling services that are available, and also the public health services. And we want you to know that these are available. We're very glad we're doing this today because mental health obviously is such a big topic to us. And I'm really glad to be able to introduce Dr. Scott Lear, who you can see on your screen. Scott has been a guest before at our Lunch and Learn events, and this time he's decided to come back on a slightly different topic, as you'll find out. Scott is a professor in the Faculty of Health Sciences here at SFU. He's also the inaugural chair of the Pfizer Heart and Stroke Foundation Chair in Research Prevention at St. Paul's Hospital. And he's a member of cardiology with Providence Health as well. Scott has been working in the field of cardiovascular health for many, many years. And those of you who know him, who know about his blog or his other social media interests, he has really been a champion and an advocate for cardiovascular health and fitness generally. And that's what he talked about the last time he was with us. But this time, Scott is coming on to talk about a more personal situation. And just before I turn things over to him, I want to just say a very special thank you to Scott for doing this. After I read his article in the newspaper, which some of you may have read, I called him up and asked him if he'd come along to this event today, and he agreed to do that. And I think as we continue to integrate mental health into our primary health care, which is really the goal of all of this, so there's no stigma attached to mental health anymore. As we're doing that, we need the leadership and the courage and the vulnerability that Scott's displaying by being here today. So I just want to say on behalf of all of us, Scott, we're really so glad that you're doing this and we appreciate it very much. And with that as an introduction, we'll hand things over to you. And when Scott's finished, there'll be time for a Q&A. So over to you, Dr. Lear.
Right, thanks, Laurie, and thanks for having me here. And this will be a different type of presentation and discussion than I'm used to. I want to qualify beforehand, I'm not a mental health expert. I have expertise in lifestyle and behavioral medicine for prevention and management of chronic diseases. And of course, some of that does touch on to mental health, but I'm here more on kind of what I've experienced over past few months and even years before, or thoughts that have gone through my head. So I'll start with I've got slides. Of course, I can't be a professor and do a presentation without slides. And let me just get those ready. All right, so during this pandemic, mental health has been discussed a lot. And there's quite a number of reasons for that. There's threats to our health. People are concerned about how their health is going to come out at the end of the pandemic. Uncertainty, you know, even if there's no risk to that individual, this uncertainty of what's of the unknown. And financial instability. A lot of people have suffered financially as well, and the isolation. So, of course, that can lead to anxiety, stress, and depression. But also at the same time, a lot of things that we're used to using for coping, like me going to the gym, physical activity, social engagement, especially travel, getting out in nature, a lot of these things have been cut off. So our coping strategies that we may be used to have gone away. We might be searching for new coping strategies, but this can actually exacerbate not having those coping outlets, exacerbate any kind of mental health issues somebody might be feeling at the time. And I've got a couple slides. There's this mental health index that Monroe Chappell creates and does a report every month. And it's basically comparing how the mental health in the Canadian population is doing due to like a benchmark. And anything in the negative means that it's less than it was pre-pandemic. And here it shows that it's kind of stable, but actually over time, it's become more of a burden to the population and to individuals. And the pandemic has been long enough that for a lot of people, it's kind of a chronic type of mental health challenges that people are facing. And that can also have long-lasting impacts to the individual, to the people around them, and to society and to healthcare. And these are some potential waves of coming out of the pandemic. There's the first wave, which is considered, so these aren't pandemic waves, but kind of health impact waves. So the first wave, like the immediate impact of the pandemic. The second wave is the delay of non-urgent surgeries. Third wave of how the impact on interrupted care. And as you can see for each of these third waves, there's like a crest and it goes down. But this fourth wave is the mental health outcomes, the long-term mental outcomes. And you can see, well, you know, these are all hypothetical cases, but you can see here that there's no crest. It doesn't come down. And that's probably going to be the longest lasting effect out of this pandemic from a health point of view. Now, I want to stress that mental health issues were prevalent well before the pandemic began. And this is, I got a few slides from a psychologist colleague who knows far more about this than me, but thought it was useful to continue to bring this to light, that out of this study published in 2005, 1 in 5 Canadian adults will have a mental illness that year. So it's well before the pandemic, and the pandemic has exacerbated this. And when I spoke with another psychologist colleague, she said all of her patients are doing worse as a result, apart from those who are introverted. She said those people, which are a minority, are the ones she found that were actually thriving and doing better during the situation because for them, it's the social engagement creates a lot of anxiety. But she also mentioned that was a very small percentage of her clients. And these aren't very glowing stats. 50% from the Canadian Medical Health Association, 50% of the Canadian population will have a mental illness by the age of 40, and 70% will have some challenges during childhood between 15 and 24. So, you know, teenagers to early 20s people, as we see people attending university or students. And then the last couple is really some of the things that we're touching on today, is that nearly 2/3 of those people won't either acknowledge or seek help for mental illness. And stigma is one of the main reasons. And stigma is that kind of that judging. I do research directly in the obesity field, and there's stigma around that as well. It's that questioning whether what you're feeling is correct or validated, and also concern about what others may perceive you to be. And I'll get into that a bit more. And this is a Wordle from my colleague who surveyed 200 undergraduates in March. So this was actually before the pandemic. And stigma shows up as the most prominent word that regarding like attitudes and discussions around mental health. And so the idea is that if we can get this more out in the forefront, then we could end the stigma and help people. And so I'm going to share with you an essay that I wrote I was having a particularly dark time in early December. And it'll, so if you just bear with me, like reading this out might bring back some feelings. And I was, as it describes, I was lying in bed awake and dealing with what's going through my mind and trying to figure out how to manage this. And so what I thought, it'll take about 5 or 6 minutes to read this out, that I would share this with you. And then I can, then I'll go into some more about the story leading to it and what's happened to me since as well. Okay, so let's see. All right, so let's begin. I know I should be strong to tough it out. Tomorrow will be a new day and things will be better. And sometimes they are, but today isn't one of them. Today is one of those days I thought would be so much better than yesterday. However, I woke up at 4 a.m. with a thought needling my mind. What the thought was doesn't matter. It can be as inconsequential as forgetting to set aside the cable bills the night before as a reminder to pay them. Sometimes the inconsequential is the worst because you beat yourself up for worrying about something so small. When I get trapped in this mindset, I tell myself things aren't so bad. Others have it much worse, as if others people's more substantial sorrows and pain should make me happier. Got a loving wife and 2 exceptional children. As a university professor, I have a salary and job security most would dream of. And as long as I have a computer and somewhere to sit, I'm still able to work during this pandemic. After lying in bed at the inside of my eyelids, I tell myself I should write this down. Writing is one of my great pleasures and it may be cathartic. But as the keys move in and out of focus through watering eyes, this may be the hardest piece I've written. The beginning comes easy. I'd written the first few paragraphs in my head, but I have no idea where it will end. It could be a perfect stream of consciousness or the ramblings of a sleep-deprived, self-absorbed middle-aged man. Right now, the critical side of my brain is fighting with my creative side, debating whether to write this in one sitting or reread it several times, editing it until it's perfect. To do so feels like I'd be cheating my feelings. I also wonder if I have the courage to continue to expose myself in such a naked way. Is courage even the right word, or is it self-serving selfishness? I'm not thinking of the reader I've never met, but about my family, friends, and colleagues. How will they feel when they read this? Will they feel guilty or mad I haven't shared my feelings with them? Will they think I'm weak? I don't want them to feel any of this. There's a lot of mental health stories written after the fact when somebody's standing at the top, looking down at the abyss they've crawled out of. I find this helpful and inspiring. There's far less written about being in that abyss, what it's like to be in the darkness, to be surrounded by people yet feel alone. Perhaps it's because it's so painful to bringing the emotion to the front. It's easier to keep it inside and let it simmer. Or maybe I just haven't bothered to look. Studying health sciences, I know all the right things to say to people in mental distress. I even write a blog that touches on some of the issues, but it's always easier to get advice to take it. And it's hard to know what's really happening inside your head when your thoughts are really screwed up. It's not like I have a terminal illness or visible affliction. It could just be a bad day. I don't think these feelings of self-doubt are unique to mental health issues. I've worked with enough people with chronic diseases and disabilities to know that if it isn't visible, people think you're fine. Those with debilitating arthritis or chronic fatigue syndrome have lost jobs in their families, not only from the disease, but its invisibility. They look fine, so everyone thinks there's nothing wrong. I should take the day off, step back, and take time for my own mental well-being, recharge. But what do I tell people? I'm not feeling well. I have a headache, or that I'm sinking in mental quicksand. Taking time off means others will suffer. Meetings will get canceled. Someone will have to do my work, or worse, can't do theirs because I can't do mine. I tell myself it's nothing, it'll pass. I'm not unique. Everyone has these challenges, especially right now during this pandemic. We're all in this together. We need to band together, or so we've been told many times. I've been guilty of repeating this mantra many times. When it gets really dark, my thoughts go to self-harm. Never tried it, and to be honest, I'm chicken. There's a reason pain hurts. I'm often able to dig myself out of it by focusing on my wonderful family and friends, but I flirt with the idea if I was physically hurt, it may stop the anguish. Nothing catastrophic, just enough to slow things down, a few days, a week. Then it'll be fine. I know that's not the case, but I can't help but think it. By now you may be wondering why I don't get help. I have, and it's not that counseling isn't helpful, but it becomes another burden at a time when I want to be unburdened. Try talking to your family, you ask? Even though we see each other so much more now, we're housebound, my family is talking to each other less than ever. They have their own challenges, and friends aren't readily accessible right now. A Zoom call just doesn't help as much as personal interaction. I'd like to blame it on the pandemic, but I've felt this way before and worse. I wish I could blame it on something. Then at least I might be able to come up with a solution that makes it just as hard as anything else. Not knowing why you feel this way. Is it a lack of sleep, an argument with your spouse, or something you're not even aware of? It's been 3 hours since I woke up. I've asked a lot of questions and I have very few answers, but I know after sharing this, even if it's between the computer and me, today is looking better than before. Let me get back to. Okay, so I'm trying to. See, and I will. Okay, sorry, just had technical difficulties getting back to the PowerPoint. So a lot of what I wrote was exactly how I was feeling at the moment. I never wrote it for the intention to be published. I wrote it, and then I actually had a piece in there. Oh, maybe I should submit it somewhere. I did submit it to the Globe and Mail, and that's the only place I submitted it. When I'm aiming for some place to publish, I will submit to multiple places. And I actually thought it was somewhat a safe bet to send it to the Globe and Mail, as they've never accepted anything I've ever sent them in 20 or 25 years. Never got interviewed for even any media or anything like that. So, but there's something comforting knowing that at least even if it's the editor's intern, somebody else would read it. I never shared this with anybody. I had pretty much forgotten I'd written it. And then I got an email in early January from the editor saying they'd like to print it. That was when this wave of, I'm not sure how to, hesitation or realization that this is real hit me. I wasn't sure how to respond. And to be honest, a lot of it was because there are two thoughts in my mind, well, maybe three, but you know, the stigma issue, what will people think? I haven't shared this with anybody. I also was concerned that still that thought that, you know, maybe for me, it's not that bad and I might actually be insulting people by writing this and sharing it with others. So I did two things. I shared it with my wife to let her know, I instantly, well, maybe not instantly, but shortly after that, I felt a weight off of my shoulders for two reasons. One, sharing this, but also, even though I've mentioned these ideas to my wife before, it's never an opportunity. Like, it's not something you mention when washing dishes or clearing the table or getting dinner ready. And then when you mention it to somebody who cares about you very strongly, it's hard for them to listen without trying to come up with solutions and help. So this was a very good way that I could leave it with her, let her process it, and then we had a discussion after. And I'd never realized the power in that. The other person was another psychologist colleague, somebody that I know, that I felt I could trust, but also I chose somebody who wasn't totally direct in my social circle, so that to kind of have a bit of that distance. And both of them were very supportive of me submitting it, so I did. And then it came out on January 31st, Sunday evening, and I didn't have the date pinned on my calendar or anything. And I opened my email on the Monday, February 1st, and there were about 5 or 8 messages sent to me, emailed to me from people. So I went through them. Most of them were from people I didn't know, people who have read this. There are a few from people I knew. And I've got a couple of the messages that to share. And this continued on for about a week, where every day I was getting messages, people thanking me, sharing me their stories, some offering help and support. I was pleasantly overwhelmed, and I was not prepared for this reaction. And that actually was just as emotional, receiving those comments, as writing the story itself. And but it also gave me a lot of strength from it. And by the end of that week, I'd received so many positive messages, and I think that has helped me in the long term. I made sure I responded to everybody that emailed me in a personal email. I then shared it on, as with what a lot of people do, I shared it on social media. I shared it on Twitter. I shared it on LinkedIn. I hesitated to share it on Instagram because that's where my family, like my parents, my siblings, they follow me. And I waited probably about 3 weeks, but what I did is I recorded the video of myself reading it out and posted it on Instagram. And but I was very hesitant because for the people closest to you, the thoughts going through my head, and I knew this wasn't fair, was I didn't want to expect a certain reaction from them, although I wanted to at the same time. And I was worried that I would be disappointed by how they may or may not respond to this. So that was, but in the end, everything was fine. Because also with my family growing up, not my wife and kids, we never had these types of discussions. And one of the nicest things that my dad wrote back to me was thanking me for sharing this. And he mentioned that growing up, he could not feel that it was right for him to express these feelings. He's been in Canada since the late 60s, but he grew up in Oxford, England, and he very much in the that type of mentality that men don't share their feelings. So I've got a couple of messages that I want to share. I probably received like 35 or plus emails. Then I did what somebody suggested never to do, is I read the comments on the Globe and Mail to my piece. I just wanted to see, and that too, there were overwhelmingly supportive comments as well, which again, I was taken a bit aback from. There was one person, I found it amusing after reading it. One person who was saying that maybe I should take a walk down to the Vancouver downtown east side and really realize what suffering is. And but then another person, and this person engaged in this dialogue, and it's this interesting thing, because the one person who engaged, that commentator, was, it's not like seeing other people suffering, whether it's worse or the same or better than yours, is going to make someone feel better. And then they had this back and forth, which actually was quite polite. And the original poster kind of came to, seemed like changed his or her tone about that. So I've actually kept all of those comments. I've kept all the emails that I've received, and will continue maybe to look at them if I'm in a bad space, but even just knowing that it's there. And so this is an example. I've got a couple examples. I've taken from one of the emails. I don't want to burden you with my troubles, which in any case are minor, but I did want to praise you for outing yourself. Whether or not you receive many emails like this, rest assured that there are many who read it and nodded quietly to themselves. Another one here. If you did, I want to thank you for sharing your thoughts and feelings. There are many of us feeling the exact same way. You are not alone. And a lot of the messages were around this of not feeling alone. I did receive one unsupportive message, which I'm going to post. And I'm posting it because it's an example of the stigma that we still have to face. And fortunate for me, I received it about a month after the article was printed. So I was in a much better place than kind of a day or two afterwards. And so here's the email. Scott, you should be ashamed for writing this disgusting garbage in the Globe and Mail. You're not a man, but a girly man, with all the weakness you describe and reveal. I question your ability to be a professor teaching students. With people like you, no wonder Canada is going down the toilet. So, and I just, putting this up, at first when I read it, to me it was so over the top that I actually thought it was maybe a really bad joke somebody I knew was playing on me. But I didn't think I knew many people who would kind of use that kind of misogynistic terminology. And then I read it and I was like, wow. And I actually what went through my mind was, and I have to admit, I replied to this person. I would say I took the middle road. I didn't take the high road or the low road, but I asked the person, that they must have a lot of hate. Like I was just expressing my feelings, and it's disappointing that they triggered such a visceral reaction in the person. I did question what the person expected would happen by sending me this email. Would I go off and cry and hurt myself, or would I immediately be cured and feel much better because this person has set me straight? And I had shared this widely as an example that things that we still need to come forward with. And so I'm not ending it on that kind of note. I've got a more positive message here. This one really struck me. It's striking how similar your experience is to mine, although I've never discussed it before. In fact, I've reread the article several times. thinking you've read my mind. Middle-aged wife, 2 kids, sleepless nights, self-doubt, thoughts of self-harm, etc. Thank you for sharing your insight and vulnerability. It's oddly comforting knowing there are other people out there who are feeling the same way. And I totally agree with that last sentiment, that there's some power in, and we probably talk about a lot about power in telling stories. And it's far more than misery loves company. And as one other person mentioned, that I wish that we could talk about these things like I could talk about my torn Achilles tendon, and get it out there more. So the last slide I've got, and I know that there's some resources in the chat. I've put different resources. I've made use of our extended benefits, EFAP, on numerous occasions. There are different websites with support lines, family physicians, and crisis lines that are available as well. So I'll end there. Thank you for your attention. And if there's any discussion or questions, I'm happy to talk about that.
Thank you, Scott. We'll bring the screen back, and I'll just say again what I said at the very beginning. Scott, thank you so much for doing this, because the leadership and courage you're showing here is exactly what we need. So we all feel this way. You can see it in the chat line. So this, as we know, it's a unlike the comment, it's an expression of strength, and we really appreciate you doing that. So I can take some questions, and you can put your questions in the chat line, or you can just raise your hand. So if I have got a couple of questions, but if someone has one ready now, please just indicate, and then we'll ask the question to Scott. Who would like to start? Steve Dooley, I believe you're a chef from Surrey, is that correct? You're on mute.
I've unmuted you, but it will ask you to accept. Yeah. There you go.
Yeah, maybe you thought I was going to go on too long. You muted anyway. Scott, I want to thank you so much for that presentation. And I don't have to repeat what Laurie said. It touched my heart, touched me very personally from things that have been going on in my own life. But I do want to ask you a question about the stigma piece that you brought up before your personal journey that you shared. And I'm old enough that I've been around a long time, and this stigma is not new. It's getting old. I'm just wondering if you have any thoughts about, and I think what you did will go a long way for our internal organization to kind of really enable people to really look at it. But I see so many situations in our day-to-day where we are meant to act and be a certain way in society, and so raising the issue of stigma. Do you see any ways for us to crack this nut in a big way?
Yeah, well, thanks for the question, Steve, and good to see you.
Good to see you.
It's a great question. You know, what was going through my head was, what would people think? You know, I thought about all these, you know, I thought about all the privilege I have in my job, my occupation, in my demographic sphere as well, and thought for me personally, that to express these things would be insulting to people who don't have that similar privilege. Like, how could somebody with privilege like that even feel bad? But I also had learned over the years that, and some of this is through counseling, and counseling has helped because it has taught me that our feelings are our feelings, and they're valid regardless of what stage or place we're in. And you know, people in all different circumstances will have bad times, and there'll be times when they're smiling and laughing as well. in terms of the stigma, I think we have to, and I'm not part of this movement, but I think we have to move it into mainstream care. So a couple of the slides that I presented were from a colleague that she's a psychologist and she's part of the BC Psychologist Association, and they're putting forward and challenging the province to make psychological services part of provincial healthcare. So we may have this as part of our extended benefits, but a lot of the times the people who need it, and especially now, people who are financially challenged, essential workers, they don't have those extended benefits. And their mantra is that if it wasn't a pill, you'd be covering it, and which I think is quite accurate. I think that, because at least for me, the thoughts around, when I've had these thoughts around self-harm have been that if I had a broken arm, I would have an excuse to slow down, type of thing. It's not like that, you know, I want to end the feelings, but sometimes it's this being overwhelmed and I don't even have the answer about what to say to, you know, my boss or my colleagues. Say, you know, I have been a bit more vocal in sometimes saying, but it still has been hesitant, saying, okay, I need a mental health day. Okay. I've said to like my staff or some things. Plus I also, you know, we talk about brave and being courageous, like, and I got that a lot in some of the messages. To be honest, I didn't feel like any of those things, pressing the submit button or saying that. I was encouraged, as I said, by my wife and a colleague to do this. So I was putting my confidence in their thoughts as well. So I think like these discussions can help, sharing these things. But I think if we get it more into the mainstream healthcare, getting it taught a bit more in medical school, because I think, you know, family physicians are also challenged with diagnosing and treating this as well. Yeah.
Yeah, so let me ask a question, Scott, and then if others have questions, please put them into the chat. Some of the questions you're raising, they're not directed specifically to Scott, but we can provide the information on the chat. Scott, you're someone who's publicly and personally has a very strong, active lifestyle. So I wonder if you could comment on any connection or any benefit you had from being physically active and your mental health.
Yeah, I think that for me, that makes a huge difference. And it's even just little things, like from the little thing where, you know, maybe I'm working on a paper or a grant, or, you know, I've been marking papers or something, and I'm just fatigued or I'm coming through the mental block. I'll find that getting out, even going for a walk, not even necessarily getting my heart rate up, and coming back, and, you know, sometimes that problem will be like, geez, I sat there for 20 minutes before and now I figured it out in 2 minutes. So that's on like a small kind of energy boost, productivity type of mental block. There have been times when, you know, I've felt that stressed, just like a lot of people, in that, you know, how am I going to get out of this, work my way out of this? And then I've hardly ever at that time are you ever motivated to go and exercise.
Right.
And even at the best of times, you know, like motivation might be starting us the idea, but it's discipline that gets us out there. And so I would force myself, and I'd go for a half hour, 45-minute bike ride. Depending on the mood I'm in, I'll like push myself hard up the hills to kind of burn that off. But coming back, I would feel like, oh, well, that doesn't seem as bad as what I thought was the case. So that's been extremely helpful. there's probably a mix of getting the heart rate up, getting breathing, getting away from putting some distance from what your concerns are, to even if you're doing it outside, to being, you know, even seeing the trees and so forth. And even now when I go for walks, there's a lot of more people walking that, you know, I'm doing the pandemic shuffle while walking to stay away from people, but it's still around people. And I found some strength in that, and going in areas where I know people are just out there walking for the sake of walking. It's been helpful too.
Right, great. So is there another question people have? Again, I've got lots of questions, but if others want to ask, please raise your hand so you can speak directly to Scott while he's here. We have another 7 minutes or so. Okay, that's what a teacher would call sufficient wait time. So I'll fill in there with, oh, please go ahead, Rachel. Yes, thank you.
No, I was just going through the chat, and I don't know if Kirsten is there. If you want to ask your question, or if not, I can read it out. But I just want to make sure that it's addressed.
Great.
So Scott, Kirsten asks, if you found that counseling was not a solution, do you have any other suggestions for people who are struggling?
Yeah, so a couple of things. First off, I wouldn't say counseling wasn't a solution. I found it's kind of another burden in terms of making the appointments, going. I was going to counseling just as through the extended benefits, EFAP. When was it? Like February, March, and a bit into April time last year. So it started face-to-face, and then it became on the telephone. And I found, at least for me, doing it over the telephone was, or maybe like this, because I didn't have to leave the house. Like I was doing it in the evening, leave the house. It was far more flexible. And so it was far less of a burden. I'm not, I'll paraphrase again, I'm not a mental health expert, but I've learned a lot more in these past few months that, you know, in some cases, there are can be actual medical, physiological imbalances that can be treated through medications. And some of the people in the messages that sent me messages were talking about that. I've talked to a psychiatrist colleague who would mention that. I've come across some other I came across one video blog of a former Olympic athlete who went through depression, and she described it as having a scratch on your brain that needs to be healed. And people have talked to me about if they are taking medications, you know, after a while they have stopped the medications as well, and it can get them through a certain period of time. And so there are those other options, but I wouldn't say counseling doesn't help, but there are cases whereby medical intervention may be needed.
Great. Scott, the question I have is, since you brought this up, something that I said at the beginning that you elaborated on is that the goal is to integrate mental health into our primary health care, so that when you go to the doctor, whether you have, as you say, an Achilles injury or you have some questions about related to your mental health, to what extent have you seen a difference in people's attitude towards accepting mental health as something that happens to all of us at varying times at some time in our lives compared to, say, 5, 10, 15 years ago?
Yeah, I've seen it. Well, I would say I've seen a big difference in a couple ways. First off, like all the messages I've received, there was just that one that was negative. I personally expected, at least in the online comments of the Globe and Mail, I at least expected far more of that. And that wasn't the case. So that, to me, showed that we have come a lot further. The other thing that, you know, being in the university environment, and also having kids, that exposes us to a younger generation. And there it's talked about more. You know, my kids learn about it at school. It's no longer something that, you know, at school it's the teacher who draws the shortest straw gets to talk about it type of thing. I did the semester in dialogue 2 years ago at Harbor Center, and that actually, you know, that experience is just as much about learning for the instructor as it is the students. And that was focused a lot on mental health, and it was through some of the students talking about this invisibility, disability, and other things, I believe, through chronic disease, that made me think, yes, we've got to talk about this more. And so I think those things are happening. And it was nice to hear Premier Horgan say a few weeks ago that he's considering looking at mental health services as part of the provincial healthcare plan. And so that's when the Psychologists Association is jumping on it to make that more closer to reality. So I think I'm always optimistic and feel that we can move forward and talk about this.
Yes. Well, Scott, you have talked about it today, and this has made such a difference for so many people. We have about 50 or so people have shown up today, which demonstrates that we all have an interest in this. So many people have, and so many people either have gone through experiences similar to what you're talking about, or they have, as you've seen in the chat, friends or relatives who've also gone through that. It's really important that the kind of empathy and compassion that people have shown you by being open, that we can do, the more we do that with each other, and the more we can accept that our mental health is just the same as our physical health, and understand that with each other, the better it will become. So Scott, again, your vulnerability and courage is something we really all appreciate. And this has been, as you can see in the chat, the most amazing lunch and learn we've ever had. And it's a perfect thing today for our welcome day, our wellness day that we're doing with Surrey. So as you can see, Scott, on behalf of all of us, I know you have to go in a minute to take up your teaching duty. So on behalf of all of us, thank you, thank you, thank you.
Yeah, well, thank you very much, Laurie, for allowing me to talk about this, because there is also something in self-healing in doing it as well. So I've appreciated, and I've come away from this stronger as well.
Great, excellent. And we'll have you